Hello everyone, my name is Amrish Patel. I'm a board certified family physician at Troughton Family Medicine. Today I want to talk about nasal inhalers and how to use them correctly. Here an example of a nasal inhaler which is used for allergies, particularly during certain seasons, for example in the early part of the year when there's a lot of allergies, a lot of pollens around, but it can be used at any other time of year, particularly for people who have all year round allergies. This is an example of one. There are many varieties of nasal inhalers, and most of them have one which the nozzle pointing upwards, a long nozzle like this. And the important thing is that you use it correctly to avoid side effects and get the maximal benefits of the inhaler. The first thing to do is take the cap off, otherwise it doesn't work. The next thing is to shake it and make sure that the drug is properly mixed in with the liquid, which is used to sort of project the medication into the fluid form and propels it into the nasal droplets into the upper airway. Then bend your head down, put the nozzle into the nostril, not too far in because you don't want to damage. Try not to touch the edges of your nostrils and your nasal cavity. Slightly outwards. Try not to direct the nozzle towards the inner wall because the medication can sometimes irritate the inner lining. Once you shake it, put it in the nostril, squirt, inhale it into the upper airway, and the idea is the medication goes into the whole upper airway, coats it, thereby reducing the inflammation which is associated with allergies. Some people find it very hard to coordinate the breathing it in. In those situations, you can just sniff the medication, press it, sniff it in, and by so doing, the medication will be delivered to the place where it's supposed to go, which is in the nasal and upper airway rather than to the lungs, or just lie in the lower airway, in the nostril area. Thank you.